So minimally invasive surgical technique for total hip and total knee replacement is felt to be beneficial, obviously not only cosmetically because it's a smaller incision, but more importantly, the amount of soft tissue surgical intervention in the deeper tissues, which is really more important than the skin incision. Less invasive surgical procedure means potentially less pain, less blood loss, possibly less need for blood transfusion, which is not something that's very common anyways with total joint replacements. Occasionally someone needs a blood transfusion after surgery. We check the blood count each day for a few days. And it is felt that it can lead to a easier and faster recovery and rehab process following the joint replacement. We feel that the MIS, minimally invasive surgical technique, has advantages, less soft tissue disruption, leading to potentially less blood loss, possibly a smoother and shorter rehabilitation, and even potentially less need for the patient to go to be discharged to a rehab hospital from the regular hospital stay and have potential to be able to go home with home health care after they're recovered in the hospital, and also progression from a walker to a cane potentially sooner. Similar thoughts about the benefits of MIS technique with total knee is total hip. Less soft tissue surgical intervention means potentially less pain, less need for pain medication, narcotics after surgery, less blood loss, smoother, quicker recovery, and less potential need to be discharged to a rehab hospital for a short stay as opposed to going home with home health care.